Hi guys, my name is Laura. I'm filling in for Travis. I'm the internal marketing manager. And today Nick and I are going to be talking about the things that you Google to try to quickly and easily eliminate your back pain, but why that might not be such a good idea. So Nick, I'm going to Google how to get rid of your back pain, and we're just going to see what comes up.
Perfect. I'm
Okay.
excited.
Okay, let's do this WebMD one because WebMD tends to be more popular.
That's a perfect one because, like you said, these ones are going to be super popular. And the way that I understand like WebMD too, there's not a lot of review, and it doesn't necessarily, just because it says MD doesn't always mean that a doctor is even writing some of these too. So that's important to understand in context.
Oh, really? Okay. So we need to look out for that next
Yeah,
time.
for sure. All right.
Okay.
So,
The thing that they have for eliminating your back pain is sleep better. Do you think that belongs in the number one spot? And do you think that's even important?
So is it important? It's actually like a huge factor, right? I think just saying like sleep better though, it's just like saying eat better or move better or exercise better, like be a better person, like whatever it is, right? I mean, without like much more on it, it doesn't really do a whole lot. Like they go and give like a couple tips on sleep pain here. Um, yeah, like, but can sleep make your pain worse? Yes. But I want to see like what all they say. Like pillow under the knees, that can be okay. Like sleep on a comfortable, firm mattress. Well, I mean, all of these things are tips you could definitely try. So, am I going to say any of them are right or wrong? No, none of them are right or wrong. They would all kind of be ones where it would just be like, all right, try this out. But yeah, I'm surprised that that would probably be the first thing listed here. Uh, because it doesn't really tell you how to get better sleep. Like I think of like better sleep as like, okay, making the bedroom completely dark, making sure like you have a bedtime routine so that you're like shutting down properly, like your body's able to calm down better. Here they don't really go into a lot on positioning. So yeah, I think the positioning one's tough because a lot of different back pains you would position differently based on the condition and what's going on. So yeah, it's still not a bad answer though.
Yeah. Always good advice, but a little bit generic.
Yes.
Okay. All right. Good posture. I know that we talk about this in our clinics, but like number two slot for bad back pain, is that what you can attribute a lot of it to? Or what do you think about that?
Uh, yeah, probably not. Like, cause here, this would be more if somebody had, so if they consider neck pain and like upper back pain, but usually people are going to say neck pain when they mean that. When they're saying back pain, it usually means low back pain, right? So that like slumped posture. Do I still definitely want somebody doing that? Well, yeah, I still absolutely want somebody using good posture. So is that going to be important? Yes, it absolutely is. But then like they talk about like the pillow or the rolled towel between like your lower back and your seat, right? That could be good again, depending on what's going on. But if somebody has more of like an instability issue or a disc herniation or something, that's probably going to be good. It's probably not going to be what somebody wants though if they have like stenosis or arthritis because they kind of want to flex their back forward a little bit and actually use like a little bit worse posture, which sounds counterintuitive, but actually will probably give them a little more relief.
Sure. Yeah. Okay. So it's more preventative than eliminating the
That
current
being said, like,
problem.
yeah, sitting up in good posture, yeah, that's just kind of like an all the time, like, yes, that should definitely be something you go with.
Okay. All right. Medication from the store. They're suggesting medicine right away. So what do you think about that? Is there a time and a place, or you just want to try to steer clear? What are your thoughts on it?
Is there a time and a place? Absolutely. Is that something that I think should be in a generic back pain article? Not at all. Uh,
Right
I mean,
next
as a physical therapist, like I can't even tell somebody like, oh yeah, go maybe take some NSAIDs, like what it's talking about here, right? Like I'm not allowed to say that. Like purely, I have to say check with your doctor. And yeah, it says talk to your doctor before taking any pain relievers. But for me, my thing more with that is like make sure that you're using it properly. Usually, it's going to say like don't use for longer than so many days, like 7 days, 14 days. and people use them every day. Like that's where a big part of the problem is. And again, the medication thing is it going to help with your pain? Generally, yes.
Temporarily. It's just a temporary fix, though.
That's
Right?
the exact thing, right? Like it still doesn't get to, okay, why are you having the pain? And now as we're looking at this, right, like there are advertisements for Tylenol like flashing across the screen there too. So it's, yeah, I'm not opposed to it, but again, you have to understand this is just a Band-Aid for a larger issue.
Yeah. Prescription pain relievers. So I'm sure that that has its own issues with the opioid crisis in the country, but you know, I see that they are good for some things, but like you were saying, probably not for targeting the cause of whatever's going on.
Yeah. And like I said, so, and I'm just looking kind of like all of what they have on here too, like muscle relaxers, like that can be the one where it's, I do like that in certain situations. If somebody has like a very acute spasm, it can be tough to calm that down sometimes. So again, as a short-term use to get that under control so we can get into some different stretches, different exercises, yeah, that can be very appropriate. But yeah, like we said, the first thing you said, they're like the opioids, like that's the scary thing here. It's not to say that opioids aren't beneficial when used appropriately. No, they're absolutely critical. It's just right context on things, right? So it's like, okay, doing that with doing something to actually address why you're having the back pain now, that's kind of the ticket of where you want to go.
That doesn't become like the sole thing that you're reliant on now.
Bingo. Yep.
All right, antidepressant medications. That is something that I have never heard personally to use for back pain. Yet it's number 5. What do you think?
Well, so it's funny, this comes up, right? And this is something that I do see. Just had a patient this morning. She goes, yeah, my doctor prescribed me antidepressants. I wasn't sure why until I looked into it. And it's like, yeah, they don't necessarily know the mechanism, which is partly what scares me on it, right? Because what is one of the biggest things for a drug being able to get to market is actually beating a placebo. So is it also that it's just having a placebo effect on you? It's like, oh, well, this is going to help. Maybe no, more for me, the thing that I'm looking at with the antidepressants is the getting off of them. I've thankfully never been on them, but a lot of people that I've either like worked with or talked to, they're like trying to get off them. They can actually have a lot of issues doing that in different manners than like some of the opioids. But it can really kind of affect their brains, and like they do have trouble with that. So it's, you want to caution against just using a medication with that.
Definitely. Hey, we made the list. Physical therapy. You know, it's, yeah, go ahead. Go for it.
I'm not gonna add a lot, right? Because all I'm gonna be doing is trying to sell something that I already sell all day long, right? From the PT standpoint, where I will say though, I appreciate that this is on here, right? From the standpoint of, yeah, it's something that we see all day, every day. Like it's one, if not the most common thing that we're gonna see in the clinics. So yes, it's very much so appropriate across all types of conditions with the low back, as far as like, again, is it any arthritis, stenosis, disc injuries, instabilities? I mean, you name it, like we're seeing a lot of different things for it.
Yeah. Don't rest an achy back.
This is something I was like, I'm surprised to see here, but I actually like to see it. And really, and let me just make sure, like, yeah, from what I can see, like they're saying like kind of the same things that I would on this, right? It doesn't mean that it doesn't mean that you're going out and just being overly aggressive, but it's stagnation isn't necessarily going to help you, just not doing anything. So it's finding those movements, those activities that you can tolerate. Yeah, that's huge. So I will absolutely agree. And I'm surprised, like I said, I'm surprised to see this with some of the other things that we've seen. But really, this is a good thing. Like, get out and get moving. That's always going to be a good thing to just help with overall blood flow. Like, movement can actually help with reducing pain levels, everything like that. So even if it's lower level, higher level, if you can, whatever you can get back to, that's huge.
Yeah, I struggle with that myself, because I've been guilty of poor posture and working at inappropriate places while working from home. And all I want to do when my back is hurting is lie down. I want to lie down, but when I get back up, it doesn't change. My back still hurts. So
It
you're
might
saying,
feel good to lie down for 5 or 10 minutes, but you get back up into that same position and it doesn't change anything for you.
yeah. So I'm better off going for a walk at that point. Okay.
Bingo. Yeah, just getting that like actual movement. Like you said, it doesn't have to be a lot. Like a couple minutes, even if it's just when you're working at home, getting up, going to the bathroom, going to get a drink of water, like just doing like a couple of those things, even just doing like some body weight squats, like just standing up, sitting down a couple times, just anything to get some pumping there. That's going to
Well,
be great.
okay. I will do that today, starting now. Okay. Ice and heat.
Ice and heat, yes. The one thing I'm not a huge fan of is their time, or not. Excuse me, not the time. I just saw the time, but it's like it says like help with the inflammation. It's not really going to help with the inflammation. Like this is a big fallacy. What it's going to do is it's going to help reduce like the sensitivity of the pain receptors. So by putting like a drastically hotter or a drastically colder temperature over the skin, your sensory receptors, so the things that send back to your brain saying like kind of the input that you're taking in, there's so much going on there. There's so much input that it basically says, oh, I don't really feel much pain anymore. Like I feel the heat or I feel the cold. And it's not going to, it doesn't penetrate deep enough to actually change any of the inflammation. That would have to be something more. You'd have to use like a laser. Usually that would be about one of the only ways to get into that. As far as like modalities that you could use. But yeah, like I liking either one. Maybe you're more inclined to use heat. Maybe you're more inclined to use ice. This is really use what feels better, or even just alternating back and forth. The biggest thing here, and it says here, is like, yeah, not sleeping on one of them. Like just because you can mess yourself up if you lay on a heating pad or even an ice pack for too long of a period.
I am guilty of that as well. I had some trouble, especially when I was playing volleyball. They would wrap us and we would leave it on from the time we left the court to the time we took a bus 2 hours home. Like we would leave that wrapped on tightly. And when we got home, we could barely walk, but we couldn't feel the pain. But
So yeah, no, and it does what it's supposed to. It will help mask the pain a little bit too.
all right, hands-on therapy, like massage.
Yeah, so
No?
I look at that right as physical therapy. Like we're going to be doing definitely some of the hands-on, but as far as massage goes, yeah, I think going to a skilled masseuse is absolutely going to be a great option for people. I think just hands-on therapy, whether it's manual therapy in here, like some chiropractors, right? Some massage therapists, like you have lots of different options here, but I think a lot of those are going to be very good as far as being able to reduce some of that back pain. I still always come back to, hey, I want to combine that with exercise because I might be able to get things lined up, things moving better where they're supposed to be, but then I want the re-education for the body. Like, okay, now that it's moving, now that everything's kind of loosened up or less pain, now let's teach it how to still move the way that it's supposed to.
Sure. Like, don't give it that time to go back to the way that it was. Just
Bingo.
keep it
And
moving.
that's where you see, like, if you look at this, like the study they're discussing on, it says, yeah, helped for about, like, they had one every week for 10 weeks. Then it helped for about 6 months, but after about a year, it was back to normal. So it's that same thing. It will help definitely in the short term, but you need something else combined with that to really make those corrections.
Sure. Okay. Nerve stimulation.
This is very similar to actually like the heat and the stim. I'm sorry, the heat and the ice, like use an electric stim. Yeah, it's going to do the same thing where it almost overloads the nerves, like I said, the sensory nerves. So the nerves that kind of feel the pain and just put so much input in there where you're like, oh yeah, I don't actually feel this right now, which is a very good thing. People say, well, yeah, that's a temporary fix. And I agree. But if a temporary fix now allows you to do 10 minutes of walking that you weren't able to do before, well, that's huge. If 10 minutes, if it allows you to get to sleep an hour earlier, right? Because you're normally tossing and turning for an hour, but if you can put this on for 10 minutes, it helps calm down, and now you're getting that actually restorative sleep. So it's things like that where this can still be very beneficial too.
a good aid. Okay.
Yeah.
Talk therapy. So a psychologist for back pain.
Yeah, and this is very true. Like a lot of people, why are they having that pain? Well, it might be rooted a lot deeper than just a pure mechanical cause. When I say mechanical, it's like, okay, if there's the joints are not properly aligned, if there's excess muscle tension, if there's a lot of weakness, well, that can be still into something else, right? Like related to something else. And this is, you can even get into Eastern European medicine. Eastern medicine, excuse me. Where they talk about like different chakra levels, right? So the first and second chakras are more where like the low back would tend to lie. Like first chakra, though, especially like your root chakra, second chakra, these are things like safety, security. So I mean, if you're just not happy with a lot of things, and or just like, hey, you're struggling to make things meet, like that type of thing, you just don't like what you do for a living. I mean, all of that can actually be rooted back to your back pain. So if if you do want to get to some of that, it's like maybe that combination of, hey, talking about this with somebody, yeah, that could be huge.
Yeah. See that. All right. Biofeedback.
So biofeedback is a much lesser utilized, I would say, than a lot of these. I like biofeedback. Biofeedback is maybe I'll put it more of like a quantitative meditation, right? So you're actually getting feedback, right, on what you're doing. And here it's talking about like your breathing, your heart rate, your blood flow, your muscle tension. Like that's what it's talking about. But it's for some people that have trouble connecting to, again, call it a part of their, well, I could even say like my neck, right? Like, because everybody can see that right now. It's like, all right, just being able to like physically relax that, right, and knowing where that's at as far as positioning goes. And so I'm just showing neck because it's easy to see, but that's kind of that same thing, like, okay, being eyes closed, like actually, oh, am I breathing properly, right? Am I actually relaxing my muscles? Like, so it's a little bit
Helps
more of
make
a high tech way. What's that?
it helps make you more self-aware.
Yes, and like I said, in a quantitative way, versus like you're not necessarily you have to be able to really feel your body much more so with a meditation versus the biofeedback. The feedback mechanism like kind of shows you a little bit more and helps you out, like a little bit more of a coaching with it.
I see. Yeah, there's so many times when I don't even realize that my breathing is off throughout the day, or like my shoulders are up here because I'm stressed about something else, and I don't realize the effect that it's taking on my body
Yep.
and how it's screwing me up later to not be aware of those things. So
And you don't, right, like how long has that been happening? Have I been like this for a minute? Have I been like this for an hour?
today,
It's tough to tell.
9 days, who knows? Spinal injections.
So injections, right? This is now getting just much more aggressive. And again, not that injections are a problem. Like we work with actually a lot of patients that are coming to PT as well as getting their injections, because if you've had chronic back pain for 10 years, I mean, yeah, we might need something else from your doctor to be able to get this under control. However, it's one of those, so they're talking like corticosteroid. Like, well, if it's inflammatory based, that can be a very big thing. You just have to be careful, right? Corticosteroids also break things down. So you got to be careful with just how many of those you're getting. A couple, one, two, maybe three. But beyond that, now you can start getting actually more joint breakdown. Like the joints can break down, the bones can break down, the muscles can break down, and can not necessarily cause damage, but that breakdown then causes other things to wear out just much faster too.
So this doesn't really, an injection doesn't really address the cause though. It's just eliminating the symptoms of it.
And yeah, so the difference, like with the injection, I tend to almost like that better than some of the oral medication. So like taking by mouth, because you take by mouth and it's like it just goes everywhere, right? But at least with like a targeted injection, yes, some of that, if I just, right, like I'm showing my shoulder here, like if I get injected right there, well, some of that is still going to spread out, but it doesn't just spread out over my entire body. So it's at least a more localized effect, right? Where it's like same concept where I'm going to go back to with, of course, I'm going to talk about physical therapy, but it's okay, get everything calmed down. Okay, now all of a sudden you're able to do twice as many exercises. you're able to do the proper stretches, you're able to do the proper squatting, the bending, the pushing, the pulling, like all of these things, you're able to walk more. So it's all of a sudden now you're able to get to those issues that were part of the problem and address them because now you calm down, whether the inflammation, the pain, whatever was that primary driver. So used in combination, I think it's fantastic.
Right. But alone, it's a temporary fix.
Yeah, I see it as a standalone thing, right? Where it's like, okay, did it actually change your posture in the way that you actually needed to address this for future problems?
Sure. Okay. All right. Surgery.
Surgery is one of those, right? It's you're not going back from a surgery, right? Once you have a surgery, you've permanently changed things. And again, it almost sounds like I'm saying bad things about surgery. I'm not. Like sometimes surgery has been the only way that I've seen patients get relief. It's just it's a much fewer, it's a much smaller area of the population. What I just don't like, because of course I'm a physical therapist, so I want to go conservative routes first, is when people have never even had PT. They've never had a lot of the, like, they've never gone for massage. They've never gone for chiropractic, acupuncture. I mean, any and all of these things. And yet they're just going straight into that surgery. And it's like, oh yeah, well, this will just fix it. And then it's, you do the PT after. Well, it's, all right, you kind of skip some of those steps going into it.
Yeah, so you want to try everything. You want to exhaust all of your resources before committing to surgery because it's going to change things.
Yeah, absolutely.
All right. That's the last one on there. And I will pull up one more Google thing and we will see if we could get through a little bit more. Oh my goodness. Let's just do the first one.
Yeah, health line, because this is another big one.
Okay, 10 daily habits to stop back pain. So this seems like it might be more preventative based, but.
So let's see.
Okay, sleep with a pillow under your knees. We saw that earlier. We discussed that. I mean, it's.
And again, well, sleep with a pillow under your knees. It's like, well, that's if you sleep on your back, but it also, so the danger in that is you, by chronically bending your knees, so you can't see my knee, but if I bent my elbow and I kept it in that position for, well, 7 to 9 hours a night, right? Well, all this tissue starts to become very short. So that can actually like shorten and tighten specific muscles around the knees. So that's why I always say, again, it's okay in the short term, but not necessarily a long-term fix for you.
Okay. Work your core.
I hate that term. I really do, right? So I want to look at this, right? Regular strength training routine, as they're talking about there, absolutely fantastic. Totally on board. Try incorporating, but it says abdominal strengthening exercises into a workout, right? That's that pains me. Reason being, there's the abdominal wall is not understood very well for a lot of people. They think abdominal work is going to be crunches, planks. I'm just going to be really working hard. That's good for the outer unit. The outer unit is very important. Don't get me wrong. Like the rectus abdominis, think that six pack, obliques, like muscles running into the side. And don't forget, like the low back, that still is the core. And that's the one thing that a lot of people will neglect. So you want to hit it from all directions, yes. But then doing the smaller inner unit muscles. So your transverse abdominis, your pelvic floor, your diaphragm, and your multifidi. These are small muscles, much smaller group of muscles that are really important to be able to adequately strengthen. So yes, I think this is a fantastic idea. It's just so much more nuanced than that. That's why I always caution people, like, don't just look at like crazy core workouts or exercises. It's like, no, you want to do some of like the bigger muscles, but you also have to get those smaller muscles turned on because those are the big ones for stabilizing the spine properly.
I know we're running out of time, but I'm going to scroll through these and you tell me if any of these you think are worth commenting on to steer.
Well, here, this next one's different. So increase your calcium and vitamin D intake. Yes, all of those things are very appropriate, like that are on there. The big thing two big things that I want to touch on with that. Well, they don't even talk about the sun, right? So they're saying immediately go eat different foods and maybe take supplements. Get out in the sun. That is the number one way to increase. And when I say get out in the sun, get as much exposure to your body as possible. It can't just be like arms and legs. No, try and get as much of your back, your chest, your legs, like everything. So I want to say that. But then the other thing, the big thing that's not talked about with vitamin D uptake and calcium uptake is vitamin K2. So foods like natto, miso are big in that. I'm drawing blanks on what else right now. But you can also get like K2 in supplement form that often is in combination with vitamin D. So yes, I absolutely agree with those things, but want to add those caveats too.
Okay. All right. Shoes, change your shoes, straighten up. That's another posture one.
Yeah, but so let's touch on the shoes. Yeah, we don't have to worry about the straighten up. We talked about that. Shoes, yeah, I like that they touch on the heels here. And even 1 inch, I would say, is a huge heel. I'm still a fan of a 0 drop shoe, meaning there's actually no heel on it at all. But that's something that you want to work into slowly because most shoes are at least a centimeter in height. Like 1 inch is really, really high. So that will cause that can contribute to a lot of back pain. So yeah, I'll say like changing the shoes, I would absolutely agree to that, decreasing that heel height for sure.
And we do have a couple of small business partners that I can give the links to if you ever needed to get fitted for a shoe.
I think something like that would be huge.
Yeah, I think they really know what they're doing, and I think it could be helpful overall. So put out that cigarette.
Yeah, smoking's not great for you, right? And here they talk about what is like the blood flow and just reducing like hydration to all those structures, right? Your discs, just I mean, higher likelihood of osteoporosis, anything like that. Also, yeah. So I don't think this is necessarily anything new, but actually very good advice on that.
Yeah. Okay, so that's that. But what I do want to talk about, or what I want to ask you before we leave, people are just they are going to Google it. That's something that people aren't going to stop doing, but what should we look for in order to count it as good advice?
Well, one thing I'm going to caution, I think it almost may be better if I give a caution, right? Like quick fixes, right? Like it's not going to be a quick fix. Get rid of your back pain in 7 days. Like you might be to reduce your back pain in 7 days. Yes. If you've had back pain for a year, for a decade, like, no, don't buy into that. Like that's just, again, trying to sell you something. Or like, yeah, so anything gimmicky there, I'm going to obviously caution against. Anything that's also, like I said, just very myopic. So just looking at only one thing. And that's where I talked about like, oh, well, taking this supplement is going to be the greatest thing ever. Taking this medication, it's going to completely fix it. Or just doing this one exercise. No, like I'm going to say even the exercise, right? Like don't look for just like one thing. Look for that well-rounded approach where, and that's why these articles actually are good too, right? From the standpoint, like, no, they're talking about 10, 15 different things that you can do because back pain is usually multifactorial, meaning there's multiple causes. It's not going to be just one thing.
Yeah. So something that we have developed recently, our ultimate guide to low back pain. I'm going to put a link to our Google form. You can go to our landing page and see that we have a bunch of different ones coming out, and it really does encompass everything that you would need to know and do for your low back pain, because we don't just address one generic cause. We get into the top causes and the top exercises, stretches that you should be doing in order to get rid of and eliminate your pain. So,
and it's broken down more into like by different conditions, right? And that's where like, so one other thing like to look for, right, is something a little more robust. Like these are 10 different things on here with a paragraph maybe on each versus what's the low back pain one, like 50 pages or so, where it's just, yeah, it's the same concept of like, don't look for the quick fix. No, it doesn't even have to be our low back pain guide, right? I'm just talking about just in general, like if it's something that it's going to take you an hour to go through, you're probably going to get a lot more out of that just based on having that much more information in it too.
Yes. All right. I just wanted to show everybody this page. You go to robinsptwest.com/guide, and then you can click on here to get one, and it'll lead you to a Google form, and you just fill out your information, and one of our members of our team will reach out to you, and you can either pick one up in the office when they're ready, or we can ship it out to you. So I just think it's a really great resource, and we're excited about it. So.
Perfect. Thank you, Laura. That's awesome.
All right, guys. Nick, do you have anything else about Dr. Google today?
No, this was fun. Thanks for coming on. I enjoyed this because I think this is a really important thing because, as you said, nobody's going to stop typing in and just searching stuff online, but it's, hey, being able to really get down to the nitty gritty of it is going to be really important for finding like the true cause and like getting to the bottom of things rather than just that one quick fix that's going to help everything.
Yeah. All right. Well, everybody have a good day, and I will see you later, Nick.
All right. Bye. Thanks, guys.
Bye.